is located on Treaty 1 territory, which is the original lands of the Anishinaabe, Cree, Oji-Cree, Dakota, and Dene people and homeland to the Métis Nation. I would like to, with this acknowledgement, honor elders both past and present, as well as acknowledge any First Nation, Métis, or Inuit participants who may be joining us today. It's my great pleasure to introduce today's speaker panel, each of whom I've had the privilege of working with during my time at CHI, and each who has had an important impact on the field of knowledge translation that I'm sure we'll hear today has reached well beyond Manitoba's borders. So without further ado, I will introduce our three speakers, starting with Dr. Kathryn Sibley, who serves as the Director of Knowledge Translation at the Center for Healthcare Innovation. She is also an Associate Professor in Community Health Sciences with a cross-appointment in Rehabilitation Sciences at the University of Manitoba. Dr. Sibley holds a Canada Research Chair in Integrated Knowledge Translation and Rehabilitation Sciences, where she studies KT and applies KT in rehabilitation research. Carly Leggett is the Interim Executive Director at CHI, as well as Manager for the Knowledge Translation Platform. She has a background in education, public health, and epidemiology, along with multiple years of experience as a knowledge broker for TREC, a national knowledge mobilization initiative aimed at improving emergency care for children in Canada. And Trish Roche is a knowledge broker in knowledge translation and patient engagement at CHI, and acting editor of the KnowledgeNudge blog. With that, it's over to you, Kate, Carly, and Trish. I look forward to your presentation.
Thanks so much, Christy. So in today's Grand Rounds, we'll share an overview of what KnowledgeNudge is, how it started, how we evaluated it and what we found, and what we envision for KnowledgeNudge going forward. In terms of conflicts of interest, we do need to disclose that Kate receives grant funds from the Canada Research Chairs Program and the Canadian Institutes of Health Research. And we are all staff members at the Center for Healthcare Innovation and have no other conflicts to disclose. For housekeeping, we will have a question and answer session following the presentation, but you are free to enter your questions or comments in the chat box at any time for us to address them. And I'll let Carly get it rolling.
Thanks so much, Trish, and thanks so much everyone for being here today. It's always a bit tough to get a sense of who's in the room when we do these types of things virtually. I think we're getting a little bit better at it, but I wanted to start us off with a quick poll question to get an idea of the audience today. And so I'm going to launch the very first poll. And it is a very straightforward question of, have you ever read a KnowledgeNudge blog post? Yes or no? And I'll just give it a couple seconds. I know we have about 60 people on the line, so we'll see. I'm going to give it 5 more seconds. All right, so interestingly, we are almost exactly half and half. 51% of you have read a KnowledgeNudge blog post, 49% of you have not. So I'm going to go to the second question. For those of you that answered yes to this, let me just pull up our second question. If you have read our blog, which type of posts do you read most often? Those related to the science of knowledge translation, those related to knowledge translation tools, those related to patient engagement, or all of the above? Equally, you love it all. All right, I'm going to give it 5 more seconds. Okay, so the majority of you are saying that if you have read KnowledgeNudge, you've read a little bit of everything and then pretty equally dispersed throughout the other types of topics. All right, thank you very much. That really helps us so we can decide how much information, how much detail to go into as we start to talk about KnowledgeNudge. All right, so a little bit about the origin of KnowledgeNudge and where we started and where we're going today. So birth of a blog conceived in a coffee shop. Shown here in this picture is actually one of the first tweets that I ever posted back in March of 2014. At the time, I was a brand new knowledge translation coordinator at the newly launched Manitoba SPORE support unit here at the Center for Healthcare Innovation. I'm shown here with Christy Whitmire, who you met a few minutes ago when she gave that very kind introduction of us. At the time, Christy was the director of our knowledge translation platform. And then in the picture with us, as well as Sunay Dubey, the then communications specialist for CHI. And we were the original 3 members of the knowledge translation team at Center for Healthcare Innovation. And at the time, we really faced an open road for deciding how to build, support, and advance KT here within Manitoba. You know, KT was still relatively young, both as a science and here in the province, but it was starting to pick up speed, and we felt that there was a real gap in both the community available here and the resources. At the same time, patient engagement was also a new and growing concept in the province, and you'll see that as our team grew to include both patient engagement and knowledge translation specialists, the blog did as well, and we really morphed from what began as a KT vision into a KT and PE vision. But back then, in 2014 at that Starbucks, Christy had a vision for starting a blog, and it launched us to where we are today. So a little bit about terminology, just starting at the very basic of what is a blog. If you Google this term, you will come up with any number of definitions. Oxford English Dictionary refers to it as a regularly updated website or web page, typically run by one individual or a small group, written in an informal or conversational style. Merriam-Webster defines it as a regular feature appearing as part of an online publication, typically relates to a particular topic, and focuses on the personal commentary by one or more authors. So really those common elements are the same. The idea that it's web-based or online in nature, the fact that it's self-publishing and has a casual or informal nature to its dialogue. So I left that coffee shop all those years ago, really, really inspired. And I wrote up this one-pager within a week. You know, we decided we had a name, we decided we wanted to call ourselves What the Health, and we had a vision. We thought, you know, in terms of initial goals, we wanted to provide consistent and innovative evidence-based information relating to knowledge translation. We wanted to become an opinion leader here in Manitoba around knowledge translation. And we wanted to build a community of readers and contributors that were interested and passionate about KT in the way that we were. And finally, we wanted to offer that space for researchers to share, you know, provide a place for critical discussion in KT and healthcare. And when we thought about our tone and what we, you know, what the sense that we wanted to portray, we look back at those definitions of a blog. We want to be engaging, unique, conversational, plain language. Interestingly on this, in 2014, take note of what we listed as our length, because spoiler alert, that'll come up a little bit when we talk about our evaluation of the blog. You know, at that time, and quite frankly, to date, common sentiment in marketing and communications is shorter the better, right? Shorter, snappier, too long didn't read phenomenon. But what we actually found out in our evaluation was a little bit different. So obstacle number 1, turns out that What the Health was already taken as a domain name. For those interested, it's a vegan documentary series by the makers of the award-winning documentary Cowspiracy. I haven't seen it myself, so I cannot confirm or deny the tagline that it's the film that health organizations don't want you to see, but it did take away our thunder a little bit because it was taken. That's okay, we soldiered on, we moved forward, and we became KnowledgeNudge. And this really came out of conversations with Pat Fauché, one of our KT team members, and you know, the idea that human nature, social psychology, other related fields have always walked really closely and hand in hand with KT. So what motivates people to do what they do? Why do people change behaviors? How can we help people make optimal choices? And how do we do that without breaking the bank? So enter the concept of nudging, which is implementing low-cost innovations to influence behavior without coercion. And I won't go too far down this road other than to say there was a really excellent book about this. And of course, we wrote a blog post about it. So you can feel free to check that out if you're interested. So armed with a name, KnowledgeNudge, we were ready to go. And we jumped in headfirst. We started a Twitter profile in early 2015. By mid to late 2015, we were ready. We said, okay, we're going to start blogging. We're going to start blogging regularly and earnestly. And that lasted for about a week. And it was Christmas, and then there was a provincial election with a media blackout, which meant that we couldn't publish any original content. Then a team member went on parental leave, the annual report was due, so on and so forth. And so obstacle number 2 is we grossly underestimated the capacity and dedication it takes to do this work and to do this work really, really well. And so we owned up to that. And one of our first posts as we move forward was owning that failure in our own hashtag KTFail. So we learned, we refocused, and by the next year, we were ready to take it a little bit more seriously. So I'll pass it over to Trish to talk a little bit about how we bounce back from that.
Awesome, thanks, Carly. So in the second half of 2016, we came back strong, posting a blog almost every single week for over a year, staying consistent even through our move from WordPress to Medium, our current platform. And in 2017, we began to recruit a number of guest authors from across Canada, including a librarian from the Translating Emergency Knowledge for Kids, or TREC, staff and patient partners from the Children's Hospital Research Institute of Manitoba, knowledge brokers and knowledge translation specialists from Kids Brain Health Network, Sunny Hill Health Centre for Children, and the British Columbia Sport Support Unit, as well as some University of Manitoba staff from various departments. We really shone in 2017, and our audience began to grow substantially, with over 1,000 new followers on Twitter that year alone. In 2018, we then felt it was important to take stock of where we were at, how far we'd come, and revisit our goals and vision for KnowledgeNudge in light of all of this. So our new vision became to become the rallying point for knowledge translation and patient engagement in Manitoba by sharing timely, practical content based on events, evidence, and expert opinion, with the ultimate goals of increasing evidence use in healthcare and meaningfully involving patients and the public as partners in health research. Dipping our toes into evaluation, we started informally through annual reader surveys, the first of which launched in 2018, and we had another in 2019 and one in 2020. And so each year, between 8 to 14 people complete the survey. So really, this is only a handful. Our readership is much larger than that, but this is kind of just a snapshot of what some people thought. Through these surveys, we've learned a number of things. Our audience members, or at least the ones that completed the survey, include research staff, knowledge translation practitioners, researchers, students, and trainees, but also includes decision makers, frontline healthcare providers, government employees, and communications and design specialists. People are referred to KnowledgeNudge via Twitter, which makes sense since it's the platform we're most active on. And that's in part because we are aware that it's popular with academics, one of our key target audiences. Although our survey respondents are only a small sample of our readership, we have focused efforts on their input. For example, by creating posts that address specific topics of interest that they share with us. Respondents to our 2020 survey agree or strongly agree that KnowledgeNudge has impacted their own behavior, skills, and attitudes in regards to both knowledge translation and patient engagement. Most respondents indicate they use KnowledgeNudge as either a quick summary or reference, and more than half agree or strongly agree that they use it actually as a teaching tool. Survey results also indicate KnowledgeNudge has increased awareness of our services at the Center for Healthcare Innovation. So that brings us to the present day, where we now have over 150 blog posts, more than 2,500 tweets, and over 1,500 combined followers on Medium and Twitter. Topics we've covered range from introductory posts, specific methods and frameworks, to posts about design concepts, interviews, and even our favorite podcasts. And so over the years, KnowledgeNudge blogs have become foundational content for many of our followers, showing up in patient-oriented research training modules, recommended readings, and used by us as a go-to reference for introducing clients to the principles behind the work we do. As you can see, we've moved on from having folks retweet our promotional tweets to actually creating their own to share KnowledgeNudge posts they find helpful or interesting. And what's really been exciting for us is seeing how widespread some of our work has become. For example, a Google search for the knowledge to action cycle, the most cited knowledge translation framework, as well as the theoretical domains framework for behavior change, both bring up our summary blogs on these topics in the top 5 search results. So we're pretty proud of that and think that's very cool. And taking all this into account, it certainly does appear that KnowledgeNudge is having some impact. But this is mostly anecdotal, based on small samples, and it's in our mandate to follow evidence and expert opinion. So with that, I will turn it over to our Knowledge Translation Director, Kate, to share our formal evaluation and some of the findings.
Thanks, Trish. So as you have gathered from Carly and from Trish, the initial focus of our KnowledgeNudge strategy was on building and operating the blog and the Twitter profile. These activities, as we've alluded to, require considerable resources. So documenting and understanding if the strategy is meeting our objectives is really important. We always advocate for ensuring that there's an evaluation plan for KT and dissemination activities so that we can determine if all of these efforts are having their intended effects. So once we were up and going in 2016 and had our rhythm established, we turned our focus to examining the effects of KnowledgeNudge in this initial period. Now, as you likely already know, evaluations can range in both size and in scope. And given that we were still running a full production schedule for KnowledgeNudge, as well as all of our other support unit duties, we focused on designing an evaluation that was feasible within our existing capacity and that harnessed existing data resources. So that meant online metrics from the social media platforms that we were using. And for this initial evaluation, we wanted to build and expand on the results of those reader surveys and particularly focus on growth as a first step. Because as a bare minimum, we wanted to find out if we're reaching people and were they engaging with all of the content that was so much work and capacity requiring to develop. So with these metrics, we conducted a retrospective quantitative descriptive study of the growth of KnowledgeNudge from a 2-year period from 2016 to 2018. We published these results earlier this year in the Journal of Medical Internet Research, and it's available open access for anyone who's interested to learn more about the methods and the findings. We had 2 main objectives for our evaluation. The first was to describe and determine changes in exposure and engagement of the KnowledgeNudge blog and Twitter profile over our 2-year period from 2016 to 2018. And our second objective was to identify and compare characteristics of high and low profile blog posts over that period, to explore why some of these posts might have more interest or uptake than others. So if all of this sounds really jargony to you, just stick with me for a minute and I'll explain these concepts in a moment. But I will pause to say that this was a new area of learning for us as well. We had to dive into the world of key performance indicators for social media use in healthcare. And this was a huge can of worms of online metrics and data sources that we learned that one could use. So deciphering all of this, connecting it to KT and dissemination science was something that we had to figure out as we went, and is something we're still working on now. But in a nutshell, what you can think of is that our first objective was focused on looking at changes in growth of the main KnowledgeNudge components. And our second objective was about focusing on diving a bit deeper into the content of the specific topics that we were covering. So let's break down each of the concepts we used for our first objective, exposure and engagement. Exposure is defined as the number of times content has been viewed on a social media application. So this is a key measure in the social media world. And for me, what I would say is that it reflects the idea of something being potentially viewed or having the opportunity to be viewed. So for example, if you had a billboard, you would want to know how many people walked or drove by that billboard in a given day or week. So that is how many people were exposed to the billboard and its content or message. In our case, exposure for the blog was defined as the total number of KnowledgeNudge blog page views per month. So basically, anytime a page was opened on the blog site in a month, this was counted as an exposure. Twitter exposure was defined as the total number of Twitter profile impressions per month. A Twitter impression is the number of times a KnowledgeNudge tweet appeared on someone's Twitter feed. So again, the number of times there was an opportunity to be exposed to a KN tweet. Engagement goes one step further. Engagement is defined as some sort of action with the social media content. So from our perspective, exposure is good and engagement is even better. Engagement is usually an action that indicates some sort of agreement or preference with the material. And in our case, Twitter was better at measuring engagement than the blog site. So we focused on counting likes, retweets, and replies as engagements on Twitter. So how did we do? So these 2 plots show you monthly exposures for blog site on the left and Twitter exposure on the right over our 2-year study period from 2016 to 2018. Our average blog site exposure during this time was on average 1,263 views per month, and our average Twitter exposure was over 22,000 impressions per month during that period. Visually, you can see the trend over time increasing. And when we split the total time course of the study into 6-month blocks and compared them with an ANOVA, we saw a significant effect of time for both blog and Twitter exposure. When we conducted post hoc analysis, we found that for the blog site exposure, we saw a significantly greater exposure in the final 6-month period compared to all other 3 other blocks. And for Twitter profile, the pattern was slightly different, with the final 2 blocks being significantly different than our first 6-month period. With regards to engagement, and so remember, these are the active actions within Twitter. Here again, I'm showing you the monthly engagements over time over that 2-year period. We also saw a significant effect of time here, although the pattern is a bit different. Here, our third 6-month block was significantly higher than the first 6 months. So what does this data about our first objective tell us? Well, what it suggests is that the growth in exposure and engagement suggests that we were successful in our goal of building a community for knowledge translation and patient engagement, which is a key first step in achieving our other goals. The increased blog exposure provides evidence that we had increased spread of information on the foundational issues of KT and PE, which is also important for our objective of providing consistent information. And lastly, the increased engagement on Twitter was actually really important, because as over time, it became clear that Twitter was a key mechanism for driving individuals to the blog site, where readers could then access our main content. So on that note, on to our second objective, where we wanted to explore more about the individual posts, which of these did well and which did not. So we started by identifying what we called high profile and high low profile posts. What we did was we ranked all of our posts by their average number of views per week, which was the number of times a page was opened at all, and the average number of reads per week, which is another indicator we could access that focused on the number of times a page was opened long enough that the entire post could be read. So posts that were in the top 10th percentile for both average weekly views and average weekly reads were defined as high profile posts. And those that were in the bottom 10th percentile for both average weekly views and average reads were defined as low profile. So that's important. You had to be in the top 10 percentile for both of these indicators to make our list, to make sure that we didn't just have a lot of people checking out a post, but then not actually taking in the content. So when we calculated this, we identified 7 high profile and 6 low profile posts over our study period. The high profile posts averaged 25 views and 6.6 reads per week. And our low profile posts averaged 6 views and 0.5 reads per week. And so I've listed the titles of each of these posts that you can scan if you like. And like us, you're probably immediately looking at them and starting to try to figure out what it is about these particular posts that make them fall into each of these categories. So that's exactly what we did next. We identified a number of characteristics that we hypothesized might play a role in these high and low profile post differences. We coded them by topic, so if they focused on a KT issue, a patient engagement issue, or both. We also coded them by what we called post type. So if they focused on a conceptual or a theoretical issue in KT or PE, a practice-based issue, or something else. We also looked at publication date to see if it was the fact that older posts may have been around longer, and that might have been why they performed better. We looked at the number of tweets promoting each post to see if that had an effect. And lastly, we also looked at word count because, as you heard earlier, it's typically recommended in communications and marketing that shorter is better. And so we have looked at all of these and compared them with chi-square or t-test as appropriate. So what did we find? Well, to our surprise, just one characteristic came out as significantly different between the high and low profile posts, and that was word count. Even more surprising for us was the fact that the high profile posts had significantly longer word counts, as you can see here in green. They had an average of 1,260 words per post, compared to the low profile post with 671. None of the other characteristics we examined were significantly different between the high and low profile posts. So what does this mean for us? Well, contrary to most advice in the blogging world, in our case, shorter posts were not necessarily better. We interpreted this as if the content is relevant, it's not necessarily about minimizing detail or information that you put out. This analysis was also really interesting to us because it showed that among our readers, it wasn't really a strong matter of interest in PE or KT that was driving readership. We got both across both types of posts, nor was there a major difference in whether it was a theoretical or a practice-based post, because again, we saw a mix in both lists. It was not just a function of how long posts existed, because we saw both new and old posts on both lists. And it wasn't simply that we were tweeting differently and that was driving interest as well. So all this to say, I'm still not sure that we have a great understanding of what is the secret ingredient for engaging content in our readers. But what we can start to rule out what we don't need to worry about. And so again, this was just a very preliminary retrospective evaluation. There were certainly a number of other indicators or metrics or constructs that we could have explored. But what it helps us is give us an understanding of where we have been with KnowledgeNudge, and the data helps us think about where we need to be going next and how we can use information to drive where we're moving forward. So with that, I'll turn it back to Carly.
Thanks so much, Kate. So looking forward, what the health comes next for us? We wanted to reflect a little bit on the future of KnowledgeNudge and where we're going to go from here. And then we did want to leave a really good chunk of time for questions at the end. I see that a few folks have put questions in the chat, so I will make sure to address those. Thanks for that, and others do please feel free to put some questions in. So looking back and trying to assess where we go from here, we have two main sources of information. We have our evaluation, but we also have our experiential knowledge. And having done this now for 6 years, I guess, there isn't much we haven't tried or explored when it comes to blogging. When we look back at our original goals, this idea of having a consistent, innovative, evidence-based KT information, being an opinion leader, a rallying point for KT and patient engagement in Manitoba, building and sharing that space for people to come together and discuss topics as they come up and they become relevant. Looking at both our evaluation and our experience, we have hit pretty much all of these original and updated goals that we adapted to when we regrouped in 2018. So we feel really good about where we've been and where we've come in terms of what we intended to do and what we set out to do. And when we think about the lessons that we have and the lessons that have come out of those two pieces of information, this is sort of our top list for you or for anyone that's looking to get into this area. First and foremost, and we've talked about this a number of times, is this idea of being consistent. Blogging 101 or any sort of virtual medium like this, the idea of posting regularly, even if it's not new content, is so critical. Don't underestimate the value of recycling or reworking old posts, trying to keep a backlog of posts, or at the very least ideas that you can draw from when other priorities take over, as they inevitably do. The annual report comes around every single year. The holiday break comes around every single year. There is always a time where other priorities will take over. But having that cache of ideas and ready to go blogs so that you can be proactive rather than just reactive is so critical. Being organized. We have had a number of staff members, myself included, that have acted as editor for the blog over the years. And I think all of them would tell you that tools such as Hootsuite or TweetDeck that allow you to pre-schedule your tweets, or project management organizers like Trello are absolutely essential to keeping all of the ideas, the timelines, the contributors on track. it is the only way to allow yourself to do that proactive work, is to have everything else organized so concretely in the back end. Blogging and other types of mediums that are similar to it are essentially creative and innovative means of disseminating information. So be creative, use visuals, try new ideas, explore different styles of writing, whether it's question and answers, top 5 lists, etc. Figure out what different authors' niche are and help them sort of lean into that creativity so that it showcases their own strengths. Know your audience and prioritize your champions. You don't always have to be too focused on gaining new followers. It's important to pay attention to what your existing audience is sharing, commenting on, interested in, what type of content they prefer, what their needs are. You know, we did our reader survey every year for the past 3 years. That was one way for us to assess what they wanted to know more about and where we should be focusing our effort. Otherwise, you become a little bit too thinly dispersed. So it's important to know that audience. It's really important to promote action. So whether it's follow us on Twitter or read these other blogs or sign up for our email newsletter, have some action for your audience and make it really easy for them to do what it is you'd like them to do with concrete steps for how to get there. And don't be afraid to fail. I mean, we did it. We're stronger for it. Blogging takes a ton of practice. If you ask any member of our KnowledgeNudge writing team, every one of them will cringe when they talk about the first blog that they wrote. Pat, our founding editor, always reminds us that your first title will suck. That's what drafts are for. And then, of course, our biggest takeaway, and we have restated this time and again throughout this, it cannot be stated enough, is understanding the capacity and resource that it takes to do something like this and to do it well. You have to look at your team and you have to look at your resource and you have to think about what you are able to put into something like this. And this goes actually quite beyond just blogging to anything in the realm of dissemination and knowledge translation. There is no shortage of big ideas, interactive tools, innovative products out there. But what is underestimated time and again is the amount of human resource and power that is required to create, implement, maintain, and evaluate these types of products. And as Kate said, you can't reserve the resource. If you can't reserve the resource to evaluate what you're doing, then you'll never be able to tell whether that initial investment had an impact. So as we think about the evolution of KnowledgeNudge, we've spent a lot of time over the past number of months looking back at our original goals, the way that our work has evolved over the years. And we're now in a place where we feel comfortable stepping back a little bit from the constant grind of blogging because we have a really solid collection of content, and we can focus our capacity elsewhere a little bit because we have built that base so strongly. We currently use the blog with CHI clients a lot, but quite commonly we find ourselves referring them to a handful of entry-level or foundational KT and PE posts, sort of as a starter kit. It's a way for them to explore and learn at their own pace, and as it applies to the work that they are doing. So we're very interested in looking into how to create a user-friendly archive of our highest quality and highest profile content, which allows us an opportunity as we move into phase 2 of our SPOR funding to help contribute to capacity building around knowledge translation and patient-oriented research. We look back at our strategy from where it started. We really started as primarily a blog. And then we moved into this identity of a combined blog and Twitter profile. And then what we learned through our evaluation is that the Twitter profile has really become the stronger, more recognized element within that identity. And so that's a piece that we really want to make sure carries forward as we move forward with this initiative. In fact, the Twitter profile actually drives people to our blog more often than the other way around. So as we move into our next year and our next phase of funding, this will be our focus, creating a strong archive and toolkit, continuing to contribute content as knowledge translation and patient-oriented research advance, and adapting and continuing to nurture the community that we have been able to build through our Twitter profile, which, while originally was intended to be primarily in Manitoba, has actually expanded out nationally. And we have a lot of readers and a lot of connection with the community that is much broader than just here in our province. So I think I want to leave it at that because I do want to leave some time open for questions. So I'm going to look in the chat here to help facilitate. Trish, I did see one question. If before you close your slideshow, sorry, can you go back to your slideshow? Can you pull up the one pager on What the Health? That original one page that I wrote. I did see somebody just asked if it would be possible to share this one pager for the blog plan. And I would be happy to. I'm going to figure out the best way to do that. It might be posting it with the video when it is available. So we video record these rounds and we will post that to the CHI YouTube page. I might be able to attach it there, or else we'll figure out some way to make sure that participants are able to get a hold of that. So that's an easier question there. Next on the line for questions is how do you connect with those communities who have limited access to services that need healthcare and knowledge? I'll take a first stab at that, and then I might pass it over to Trish to think about as well. This is something we talk about a lot, meeting people where they are at and understanding that when engaging folks and engaging communities, they might not have access to a virtual means of communication. So we do talk about this a lot, and we understand that our blog is going to be one of many tools, and I think it cannot be the standalone tool that you are using if you do want to connect with different communities. We have done actually a number of blog posts and presentations on how to connect with different communities in different ways, how to meet them where they're at, how to engage, particularly in times of COVID when we're living in a really virtual world and it becomes harder to do that type of work. So I think the short answer to that is knowing that the blog is never going to be your full answer because it will not catch all of the people that you want to reach. And Trish, did you want to add anything to that from your patient engagement expertise?
I think in terms of both audience and authors and contributors, it's often with the blog itself, getting it out as a dissemination tool, not so much connecting with communities who have limited access, but we have been able to more so bring their voices to the blog so that our audience is familiar with what kind of challenges they might face, what their perspectives might include. So that includes having our CHI's Patient Engagement Collaborative Partnership co-author a blog. And we hope to do a lot more activity like that to maybe bridge that gap a bit.
Sarah Kreindler, thanks for your question. You've asked, given the substantial capacity and resources required to post consistently, should individual researchers even try to blog? Should they instead try to guest blog for existing blogs like KnowledgeNudge? Should they tweet, etc.? So that's a really complicated question. It really depends on, I would say, and I'll let Kate and Trish jump in, where your passion lies, where your resource lies. I always advocate when I do consultations with clients or independent researchers to think about if somebody else is already doing that work and doing it really well, is there an opportunity to collaborate? That's something we did within Trek, actually. We had talked about podcasts for a long time in the Translating Emergency Knowledge for Kids initiative that I worked on for so many years. We talked about podcasts and doing podcasts. And then we recognized the amount of resource and energy and time and money it takes to do that well. And we realized somebody else was already doing it. And then the step became about making a collaboration with them, where we could offer them some of the pediatric content for their already existing podcast. So I think it's a combination of things. I don't think it's ever a bad idea to think about collaborating if somebody is doing it really, really well. But that's not to say you shouldn't blog if you are passionate about it. Kate, do you want to add to that?
Yeah, I think I like this approach because it gives me time to think about my answer in advance. So thanks for that, Sarah. You know, as yeah, I think as individuals, I think this thing to consider, and I think one of the key things we've learned over the years with our dissemination activities is there needs to be a strategy. And so really sort of planning and thinking it through, like, is what we advocate. So if building and if it is part of the strategic component of your dissemination work, and you see that as being a component of what you want to do, and being also able to kind of link it back in, I think there's potential there. But what I certainly would not advocate is for someone to just sort of pull up a WordPress site and start going, because I actually have friends and colleagues who've done that, right? And what we have learned is the amount of capacity that it takes is quite significant. So I'm not sure that every researcher out there should have their own blog. And I think leveraging the existing networks and communities when you have a particular piece of information or finding that you're looking for is to your advantage to doing that. So that would be my reflection. Or I think the other thing too is, again, this was part of our support unit grant. Essentially, this was like one of our main activities as a support unit, the KT component of our support unit for the last 5 years. So as an individual, I cannot see you being able to resource this off the side of your desk, right? Again, so strategically thinking about it becomes an intervention in itself, and how do you plan for how you're going to resource that, evaluate that, and operate it. It could be part of a grant or something like that. So it definitely needs a plan.
Yeah. Thanks so much for that, Kate. There are 3 questions in a row that are editorial in nature, Trish, so prepare yourself, because I'm going to hit you with 3 questions in a row. So the first is about the Twitter profile. Interesting that the Twitter profile is the driver, given the findings about length. Do you think then that Twitter is serving as a form of advertisement to draw people to the blog? So the people who take the time to go to the blog are keen on the depth and not the short message.
I think it's yes, short answer. It's definitely a way of advertising the blog. But we also do get some organic hits from Medium itself. So I think it really does relate back to that exposure metric in terms of how are people seeing it. Twitter's way more popular than something like Medium. Medium might be becoming more popular, but and as it does become more popular, we do see more people reading directly from Medium, and we're showing up there. But definitely Twitter, easy to access, easy to use, lots of folks on there, has made it really part of the success of KnowledgeNudge for sure.
Thank you. I'm just going to link 2 questions here first. So about having posters and info posted in patient areas and whether or not patient partners involved before decisions are made. And I think it's interesting to make a quick distinction here. And we've struggled with this a lot because when we wrote the paper, it was really hard to section out in our mind the fact that we were writing a KT paper. So we were advancing the science of KT, and it happened to be on the topic of KT. And it's interesting to tease those 2 out, right? And it's a little bit the same with patient engagement. So the blog itself and the way that we use it around patient engagement is to help folks that are involved in patient engagement or are looking to advance their skills or knowledge around patient engagement, whether it's researchers or health system or patients themselves, in how to do that and some of the theory and foundation. So the blog in and of itself isn't necessarily a way to engage patients, but it is a way to learn about the concept and the realm of patient engagement. That said, our collaborative partnership that oversees the work that we do here at CHI has been quite involved in the blog and has acted as guest authors a number of times. So that's the primary way that patients are involved in the implementation of the blog itself. So just a quick clarification there. Trish, another editorial question for you. What is your editorial process for the posts?
So that's evolved definitely over the years because we have quite a few people who have served in the editorial role. How it generally works is, we'll brainstorm ideas with somebody who's interested in writing a blog, kind of outline the process, what we're looking for, throw ideas back and forth. And then they'll go off on their own and draft something up, usually in a Word document because it's just easiest that way. They'll send it to our editorial team, and one of us, at this point me, will review it for just to make sure it's in the blog format, because we do find it challenging to translate that information, evidence that's in very academic language or formal language into something more friendly and reader friendly and usable in the blog form. So that's definitely part of the editorial process. And then we always have at least 2 people look at it. So sometimes there's back and forth with the author if we have questions. But generally then once that's kind of in good shape, it goes up on Medium in a draft format, and one of our other editors will take a look for formatting, spelling, and last minute checks. And of course, there's all the lineup of Twitter posts and getting promotion ready and preparing the graphics. That also is part of the editorial team's duties. So yeah, it's quite a process, but we've it works well. It works well now, yeah.
Well, and what I'll add to it, Trish, too, for folks from a strategy perspective, what we've taken to doing for the past couple of years is, I would say, every 6 to 8 weeks? How often do we, 3 months maybe? We have a blog strategy meeting as a whole team with our entire KT team, where we look at a calendar for the year and we map out the month with general themes. So one month will be a patient engagement theme, one a knowledge translation, one maybe communications and media or tools. That way the contributing, because authors tend to cluster, right, around their area of expertise. So chances are they're going to have a couple of posts in a month, but not every month. That gives folks an idea of what's coming for them. They know that November is maybe going to be their month and they might have 2 blog posts to do. And then Trish is excellent because then due dates start showing up in your calendar. Right? So we have an editor who is very on it. As an author and a contributor, she makes sure you understand your deadlines, your timelines, and supports you through that process. So a lot of thought goes into that. Sorry, Kate, I'm going to kick the next question over to you. Have your expert contributors published their content traditionally? And if so, have they encountered tensions with academic journals? And also, how are blog entries valued as currency in academia?
Great questions. So with regards to, I don't have specific data on, I think the short answer is that depends. There's different types of posts that we have. And the posts could sort of come from a range of different places. So definitely much of what we publish on is based on peer-reviewed academic literature or publications. And what I always sort of try to advocate is what we're doing in these posts is we are pointing readers in a summary format to the foundational content pieces in knowledge translation or patient engagement. So for example, we have a summary post done by one of our students and knowledge brokers on the knowledge to action framework, which many of you are likely very familiar with. What we do in that post is we summarize what is the knowledge to action framework, citing it. It is absolutely not us who created it, and why it's important, right? And so that is really sort of the tone of that content of the blog is, here are the key things. We're summarizing this in less than 1,000 words. This is a really seminal piece of information. Now you need to go read the whole thing in its full form, right? And trying to sort of connect the dots for folks around why it's important, why it matters. And we can't do everything for this for you. This is why you need to go look for it yourself. So most of those types of posts would be strongly sort of referenced. And so in that sense, I would say in most cases, sort of the primary form of dissemination would still be peer-reviewed academic content, because the peer review process is absolutely critical. Certainly I myself still publish academically, and then what I would also do is write a complimentary post on the blog in that as well. So in that way, I have not experienced personally, or I haven't heard of too many tensions with the journals. And again, we work very hard to source appropriately, get permissions for figures, all of those sort of things. So that's the response around that component. How are blog entries valued as currency in academia? Second great question. We're actually doing a study right now on knowledge translation recognition in tenure and promotion policies across Canada. And so we hope to have that ready to share in the next year or so. Certainly I think it's peer-reviewed publications are still the bread and butter in academia, and there's good reason for that. We also know there's challenges for that, right? So again, we see the blog as being a nice complement for engaging different types of audiences. Again, I'm not sure an academic reader would come to the blog as their primary source, but among practitioners, and when we want to promote and enhance evidence-informed KT and PE practice, we see the blog as being that link between the academic and the real world, for example. So, I report my blog entries, and we all do as dissemination activities. I report the metrics on my blog. Is that the definitive measure in my promotional considerations? Probably not. But I definitely see it as, building my network and engagement beyond academics.
And the one thing I would add to that in terms of currency, a little bit more anecdotally, we actually use and consider the blog a really good tool for building capacity within our team. This style of writing is a different muscle, right? Kate has a large program of students that are part of our community. We have a number of staff that are in our KT platform and even beyond into different platforms at CHI. And this style of writing is a very good exercise. It's surprisingly difficult. It's just a really good way to keep your writing nimble, to practice. Everybody takes a little bit of time to find their voice in this style of writing. I was actually really gutted when I saw the results about length because I'm a short writer. I love that 500 to 700. We have other writers that are much more verbose, and we're delighted to find out that they could do longer blog posts, right? But for our team, we really encourage people to get creative and go out on a limb a little bit in terms of practicing this style of writing. Does anyone have any other questions that they would like to pop into the chat? Or Trish or Kate, do you guys have any final thoughts that you wanted to? All right, I think that's good then. I'm going to pass it over to you, Christy, if you wanted to just close out. Thanks to everyone. Oh no, can we unmute Christy for her? There we go. Put a security setting on. Sorry, Christy.
No problem. There we go. Well, thank you so much. That was a fantastic talk. I learned a lot, and it's really exciting to see how much the blog has grown, and it's such an excellent example of, developing something, sticking to it, evaluating and changing as you go. So thank you again for the wonderful talk. Thank you to everyone for your questions, for participating and attending today. And as was mentioned before, the recording will be posted on the website, I think in a few weeks probably. So if you want to look back for anything, feel free to revisit. Thanks again.
Hey, thanks everyone.
Thank you. Take care.